Okay, so I'll be getting a blood sample from this patient. I already addressed them, checked their bracelet, any allergies previously when I accessed the port. So reintroduce myself. Crystal, I'm your student nurse, will be doing a blood draw from your port. So I have my syringes that I need. And here, first I need to make sure that my site is clean here. So I'm going to use one of these site scrubs. I'm going to scrub it for 15 seconds. Okay. Then I'll take my 10 milliliter normal saline flush, attach it here, unclamp my line. And then I want to aspirate for a blood return. And we got one. If we didn't, again, I would have them raise their arms, cough, deep breathe. So we'll do the push pause method. And then I need to draw blood for the discard as well, because you don't want the blood sample diluted. So like if they were hooked up to IV solutions or anything, I would have to pause the IV solutions for 1 to 2 minutes, or according to policy at minimum, so that it's kind of flushed through the system. So then here, I want to aspirate 5 milliliters minimum. So that kind of depends too. If I feel like it's kind of diluted, if there's still medication in it, I could aspirate, 10 milliliters, to see if that was a little better of a discard, because that can skew a lot of labs that you get back, and you don't want to be doing that at all. So I'm going to set my discard to the side, recap it, and to the side so that I know that that's my discarded one. Then I'm going to scrub for 15 seconds again. Okay. Take my sample syringe. And then whatever the order is for this blood draw, you would aspirate that back into the syringe. We'll say this one is 5 milliliters. So I have 5 milliliters, I'll take it off, set this in my packaging. I don't need to keep this sterile, that's not necessarily the point of this one. And then I need to scrub again for 15 seconds. And then I'll need to label that sample with the date and time that the blood was taken with the patient name. And one final flush, because I don't want to leave any blood in this line. That causes a risk for infection here. So, and then again, this is according to facility policy. I'm going to do the push pause method. We'll say today that the policy is to flush with 10 milliliters, some are 20 milliliters. And then I'm going to do one more scrub for 15 more seconds. I'm going to put this cap on here. Clamp my line, and then I would make sure it's taped so that it's not moving. I would perform hand hygiene and document my findings. How much blood I drew, that I got a blood return,